My name is Chloe. I'm 23 years old. I'm from the UK and I'm in my 6th year of studying at MUS. I think the reason why I decided to come was that's a funny story. My friend wanted to come and study dentistry here, and then we went to an open day with a different agent, and we were going to apply to study here together. He left me, he's doing something else now, and I decided to continue on because I thought, you know what, if it all fails, it's okay. I've got, this as a backup plan. And because I wanted to become a doctor so badly, I said to my parents, can I go? My mum was really skeptical. She's heard of Bulgaria before, but she's never actually been. My dad was like, yeah, go, do it. Why not? You're young, go ahead. And we went to, my parents actually came to Bulgaria in February of the year that I came, and they found internships. They basically went around and asked loads of students saying, oh, my daughter wants to study here, what do we do? And then they introduced internships to my parents. And then, like everyone else, it was just more of I couldn't get into the UK and I really wanted to do what a passion of mine, and that's why I'm here. And I didn't want to resit a year because it was one of those things where I didn't want to waste a year of my life and wait even longer because I know I would regret it. So I don't regret anything. I'm glad I'm here. If I were to start first year again, I'd probably go to more events and societies because I was really introverted, so I didn't make friends very easily in the first 2 years, I would say. And if I actually went to those events when I was invited by just mutual friends, it might have been easier to make friends that way. I would also probably ditch buying textbooks. I spent so much money on buying textbooks, and you can get all of them online, and now I have to carry them all back home with me. And my bank account really hurts with the amount of money I spent on my books. So if I were to do that, I probably wouldn't spend money on books unless it was something that was really fundamentally important in terms of I know there's an anatomy book that's really important. The Gray's clinical practice book is huge. And I know a lot of doctors still use that. So maybe that's the one textbook I would spend money on, but everything else, I'd leave it. I just use it digitally. In first year, I definitely had struggles, a lot of them. I would say one, moving abroad so young, that was a big struggle of mine. And not having my family with me, that was another big one. Along with the fact that the teaching style is very different, really, really different to what it's like in sixth form. That's the biggest. I was baby fed in sixth form, and then now I was just required to learn everything by myself, and that was a big, big struggle. Studying during COVID was probably one of the most difficult things. I think just no one was prepared for it at all. So the professors were confused, we were confused, and it took a lot of time for everyone to adjust to it. I think also with the fact that I wasn't in Bulgaria during the time, I was stuck in the UK during the pandemic. So the time difference didn't help, and not being able to ask my professors in person for help was difficult. And also I didn't get patient contact at all until recently because obviously you can't put patients' life at risk, and we have to get tested in order to make sure that we don't put them at any more risk than they already are. So I think the lack of patient contact has given me some doubts in my own skills, especially working with patients, but I'm sure I'll pick it all up soon. In first year, I definitely did want to drop out. There were times where I felt like I did not belong and this was not the right degree for me, even though I felt like I wanted to do it for so many years. But I think the thing that kept me going was, one, my group mates and the people around me, that include my friends and my family. And I think the fact that my parents let me go back every single month, which I feel very blessed to have flights every single day to go back home and see them every month, helped a lot, along with the fact that my friends were always there to kind of pick me up when I was not feeling it. Even now, I still get days where I'm just I want to quit, even though I'm only 6 7 months away from finishing. And having that support system, even if it's just one person, be it family or friend, is the most important, and making sure that you let them know that you're struggling. Because if you don't let them know, then you feel even more alone, and that's when you probably feel your most vulnerable and your weakest. And I think everyone's able to do it. There's no subject that you can't do. It's just whether you have the right resources, the right people, and the right mindset to do it. And it's easier said than done, 100%. And I'm not saying this from saying that I'm perfect as well when it comes to wanting to drop out on subjects. But you know what, like before you know it, you'll be in third year, you're halfway there. Before you know it, you're sixth year, and then you're nearly done. I think that's the biggest one. Time flies by really fast. So if you just think of it like that, then it'll be a lot easier. Even now, I genuinely still get imposter syndrome where I want to leave. But that's so normal, and all my friends get it as well. And I feel like that's just a thing that people don't talk about, because it's obviously a vulnerable stage where you're like, you're nearly finished, you're nearly a doctor, how do you feel like you're still not ready? I feel like it's one of those things. And I think a lot of my graduate friends do say that you learn a lot in practice. And right now, I'm still learning, so I'm just looking forward to that part. I don't know whether I would have a career change, just because I think whenever anyone mentions it and they say that maybe you could go into finance and technology, which I know a lot of medical graduates can go into that, I'm thinking, for me, I spent 6.5 years of my life crying over a degree that I don't think I will ever want to give up on that dream. That's just for me, but I do know there are people out there, especially like content creators and things like that I've seen on YouTube, that have decided to give up medicine because they found something more passionate for them or even financially beneficial for them. And I respect that wholeheartedly, because life is never set in stone. And if I were to have a career change, maybe 6 or 7 years down the line, I wouldn't regret it either. I think it's just something that I want to just take on the head and just appreciate that I have the opportunity to do it. Yeah, I think that's the career change one, because I did think about changing careers, but I'm thinking 6.5 years, no, not throwing that away. Not for a career change, not yet. Hardest year mentally, first and second year, 100%. Hardest year academically would be third and fifth year. Because mentally it was just moving abroad and all of that, not having that many friends to begin with, and the teaching styles, like I said. And then the subjects are very different in second year compared to first year, because first year is mainly really a catch-up year for everyone. And second year, when anatomy hit, I was on the floor, I think. I was crying all the time, I hated the subject. And then third year, academically is hard, because that's when you start your clinical years with internal medicine, and that's when you start speaking to patients in Bulgarian, and that's also very difficult whilst learning Bulgarian. And then fifth year, because the exams are just big. The exams are just really, really big, and these are the exams that you also sit in your state exams, which was also stressful, because you had to think ahead of time to make sure you have all of the resources ready, so when we sit states, it's so much easier for us. And you have to prepare yourself mentally to sit the state exams as well. I think for me, the hardest exams in the past 6 years would be biology, pharmacology, anatomy, and pathology. Biology, just because it's a big syllabus content, and there has been things in there that I've never covered before prior to doing biology at the university, such as parasites. That's never a thing I did, or immunology. So that was difficult, and the professors are also a lot more stricter and very precise with what they want from you in the exam. So for a tip for that, I would just say use the resources that they give you, such as their textbooks. If not, make sure to attend their lectures. Ask questions in seminars, that's the biggest one. If you ask them, do we need to know about this? Or do you recommend this textbook? They would be more than happy to tell you what they would recommend for you to use. And then for anatomy, that was difficult just because it's a very long exam. There's about 4 parts to it, so it's very mentally draining on that day with no sleep as well. And the content of it is big. It's a big syllabus. It's 200 and something syllabus points, and you're learning, you're remembering everything from first to the end of second year. So that's why that one's a bit tough, and I think that's your first ever big exam in med school. Pharmacology was probably a hard one just because of the prescriptions. You're writing Bulgarian prescriptions, as well as the subject itself is a bit difficult. I found it very difficult anyway. Pathology was hard. That's because the pathology department is also very, very precise in what they want and specific. So again, with that one, attend the seminars, go to the slides rooms and look at the slides, discuss it with the professor, discuss it with your group mates. And I think the tip for cytology, pathology, similar in terms of you need to use microscopes. Take a picture of it every time that you go to the slides room and write on your phone using the marking tool what characteristics you see. And then the more you see it, the more it becomes familiar to you. I think that's the main one with cytology and pathology, is just the more you see the slides, the more you recognize whatever the slide is and what's wrong with it. The year where you have probably the most time would be 4th year, just because a lot of the cycles you don't have exams. So you get the time to take off. That's when they say to travel the most. And I know a lot of my friends and just people I know have jobs at call centers. So it's work from home kind of environment. So you'd be able to find a job like that. I don't know where, but I know people have. I did internships back in the UK for maybe 2 or 3 weeks. Those are just more shadowing doctors more than anything. And internships in Bulgaria, I did maybe one just before COVID at the military academy in ENT, and that was really good. It's more of a job just to go and ask the secretaries at the BMA to give you a doctor to follow, and they'll teach you. I mean, all the doctors in the military academy are very nice, so. That's the only internship I had, was just before COVID. For the UK, how I found an internship is just emailing the HR department of the hospitals and the trust. It's a very long, tedious process, but if you explain that you study abroad and you want to come back and you also have the right to work in the UK, they'll probably be able to help you find something. A lot of them won't reply, but don't give up. That's the biggest one, don't give up. So from what I know, at MUS, no one does their final year out of Bulgaria. I know there are, if you want to do maybe a semester abroad during your studies between like 1st to 5th year, you can apply for an Erasmus program. I know there have been some students in my year that have applied to that and studied in France, I think. And there are Erasmus students that come to Bulgaria to study as well. So I know that MUS does have this program or this scheme going on that you can apply for. You just have to have the grades for it, I think. Even up to now, for Erasmus students, we still get Erasmus students in my cycle. It really just depends on what year you apply. I would say if you were to pick a year, again, I would say 4th year, just because you do have time in 4th year to take out to do that and go to a different country and experience the other country as well as studying. And in Bulgaria, especially at MUS, you don't do exams in 4th year as much, so you wouldn't be missing out on exams, if that makes sense, because to get the credits, you have to obviously sit the same subjects for it, so you have to make sure that your program aligns with the Erasmus school program as well. My most interesting experience is probably not during my internship, but was during my obstetrics and gynecology cycle in 5th year. I watched a live birth, like a natural birth, traumatized me. This was insane. I think in the morning we saw the baby on the ultrasound, and then not even 4 hours later, it was wrapped up in a little blanket. And that was crazy. I think the mum was more laughing at us, being shook and very just surprised on the other end of her. And the doctor was telling us that this is, you shouldn't be surprised. And I called my mum afterwards to apologize. It was a very traumatizing experience, but it was beautiful afterwards, but during it was not a pretty sight to see. I think that's my most memorable experience, 100%, or it has to be with, my other memorable experience would probably have to be forensics. That was, never experienced anything like that before, and they are not lying when they say it smells really bad. I think the first time you walk in there and you smell dead bodies, but fresh decomposing dead bodies, is very different to the cadaver room in anatomy. And just some of the injuries and the causes of death, it's interesting. I don't know if I'd ever do it again, but I'm very grateful for that experience. Despite my obstetrics and gynecology experience being traumatizing, it was also one of the most rewarding things. I think after the whole giving birth part, seeing the baby and the mother thanked us, I didn't do anything, I just sat the other side. And she was still she was happy that we were going to become doctors. That was nice. And a lot of the times when you meet patients, especially old patients, where you treat them with care and you talk to them, they're grateful. And then I think it's the gratefulness that people have for even just like the professors that are treating them is nice to know that you're helping someone. Like you make an impact, even though to you they're just a passing patient, but for them you're someone that's made their life that little bit better. I think that's the biggest thing. When you actually see doctors really putting their heart into it, that makes it just like, oh, that's nice. An interesting rotation would probably be pediatrics. That was fun and interesting. I think it was working with like children and working with their parents mainly, because you're speaking to the parent for the child, and that was a difficult obstacle, if that makes sense, but it was still super interesting. Seeing kids, like, I don't know, it was the way that the doctors were handling all of the cases was really interesting. I think that was my most enjoyable cycle, and it was really rewarding when things worked out, I think, and you built a relationship with the patients because they would recognize you coming in every day. Oh, it's an interesting one. Teenagers would hide a lot of things from their parents. So a lot of, there were a couple of teenagers that we saw that wouldn't, in medical history, didn't drink, didn't smoke, didn't take drugs. But then when we spoke to them, they admitted they drank, they smoked, and took drugs. So it's like, it makes it a lot more difficult. Like the patient history, if they're lying to their parents, because we're not allowed to talk to them really, we're only allowed to talk to the parents sometimes. So that's interesting as well. It really depends on how you build your relationship with the patient, whether they trust you enough to tell you, especially with teenagers, because teenagers are very difficult to work with, just socially. I think to study medicine, the biggest preparation that you should have is how mentally draining it is. That's the honest truth, and it's the harsh truth, is that medicine's not an easy degree in terms of content. It's a lot of memorizing, and it takes a lot of time for that memory to kick in, and it will make a lot more sense the more you go through your years, because it's like a big puzzle. You can't just have one piece and expect to know what the entire thing looks like. You have to finish the other sides of it to understand. And I think that's, for me, the biggest thing was I went into medicine thinking, I don't know this, that means I'm never gonna know it. But now that I'm in 6th year, I look back on it, it does make sense. And I think that's, you just gotta be patient as well. A lot of patience with all the subjects and yourself, and a lot of discipline, which I don't have. So I'm going to be honest, I don't have it. So that's like a big thing that I'm still working on 6 years down the line. But you just have to be very mentally prepared for it to be quite exhausting at times, especially during exam seasons, and to make sure that you always have a good way to relax. I think that's another big one. And give yourself time to relax. Don't say that, oh, I have to study. A tip I would give people that are just about to start medical school is to remind yourself that imposter syndrome is a thing. It's okay to feel like you don't know anything, because I feel like a lot of people around you don't know anything as well. They're just not saying it out loud. And there is this stigmatism to not talk about not knowing things or lying about how much you know or don't know. I feel like if you just ask for help from people around you, from the professors, from your friends, and do study groups, it helps a lot more. I think that's like the biggest tip, is actually being able to admit that you need the help and to ask people for it. So in my first year, I was super introverted. I didn't go out at all in my first year, and I think that was hard when it came to second year for me to make friends as easy. But I was very lucky in the sense that my group mates, my group shuffled around a bit and there were new people in there, and that's how we became friends. I became friends with the girls in my group, and that was really nice. And then from there on, obviously they know people, and then they invite me to like dinners and things like that, and then it just started to go from there. I think it's one of those things where I was really fearful in first year, where I wouldn't make any friends at all in the 6 years that I was here, but I think it just took some time. In terms of societies and events, now that I'm a little bit more extroverted, I do go to events a lot more, and that's where you meet a lot of people. You start to follow them on Instagram, and then you reply to their stories, and that's how friendships have started for me. So that's quite nice. I would say just any society event that looks interesting, join it. If you don't like it, you don't have to go again. But I would say it's one of like a really good way to meet new people. Any freshers events, go to it. Any volunteering, go to those, because I've volunteered at Interhex for like a couple of years now for the freshers events, and that's how I meet first years as well. And then I've kept in contact with some of them, and now they're in third year and fourth year, so it's really nice. I think my best tip for someone starting in Bulgaria would be to find a flat early. That was a thing for this year when I mentored a couple of students. All of them still hadn't had apartments and things like that. And if it were me, I would just come a bit earlier, maybe two weeks early, not even, to find an apartment so you can settle in a lot nicer and you don't have to be moving around whilst you start your year. Another one would probably be get a phone plan, because there's a lot of just delivery services and things like that. If you want to get post, just anything, you need a Bulgarian phone number. For example, I don't have a Bulgarian phone number. That was a big mistake of mine. So I rely heavily on my friends for their Bulgarian phone numbers whenever we do things. Another tip I would have, make sure to travel. I know that doesn't sound like a thing to do in first year, but there's so much to do in Bulgaria in terms of like hiking, skiing, sunny beach in the summer. There's Greece that's not that far away. I would say that like these are my biggest tips, because I regret not traveling as much, and now me and my friends are trying to cram in as much traveling as possible before we go. Tips for surviving in Bulgaria would be to speak the language, and even if you don't know it. I think people just appreciate you trying. I think that's the main one. They may look very scary, which I've noticed with the older people, they do, but once you try to speak to them in Bulgarian, they're really sweet. I feel like it's just, for them, they're probably a bit confused as well, what's going on if you speak to them in English. They probably never learned it, so you can only respect them and try to speak the language, I would say, is the biggest one. Also learn the culture. It helps when you can speak to Bulgarians about their own culture. That's a big one. My tip for MUS would probably be, if you feel like you're having a hard time with a subject, you're not alone. Just your group's with you, the people in your cycle are with you, the people in your year are also with you, so just go and ask for help, or just talk about the problem itself, and maybe you guys can come up with a solution to it. I think you need to remember that everyone's in the same boat, and if it starts sinking, you're all sinking. So help each other out is the main one, I think. Don't gatekeep. That's the big one, don't gatekeep. So the way I study for exams is, I'm sure everyone already knows this one, there's notes that are made by the people from upper years, and I use those as a benchmark or a reference of what I need to know for that topic. So I use those notes to look at, and then I do extra research using just textbooks that the uni has provided or recommended, YouTube videos around the topic, and then I write my own notes on top of it, and then just use that as flashcards, mind maps. I've tried everything. I still don't really know what works. I just have to keep changing it to feel like I'm doing something different because I can't do the same thing. So I do like mind maps, I think the most, or whiteboards. And then group study sessions, those are great. So what me and my friends do, we set out maybe 10 topics each, and then we will teach each other those 10 topics, or do exam style studying where we ask the person, can you do point 10? And then they talk about point 10, because that's how it is in the exam, and it's all oral as well now. So that's how we do it. So we just do like exam prep like that. I think with uni, the books I would recommend are the TM books. They're a German publisher, I think, or a book that they do loads of. So the anatomy, I use only the pocket books really to study for anatomy. Anatomy is also the university professors love Sinelnikov. They love that book. It's like a Bible to some of them. And the Oxford handbooks are the ones that I would suggest as a quick reference book. They're really good. Up until now, I still use them for subjects like ENT or internal medicine. They're really good. Ninja Nerd was really good. Osmosis is really good. Amboss is also really good. These are the three that I think are the main ones that I've heard. And I use Osmosis and Ninja Nerd, but I don't use Amboss. Most of my exams were oral up until COVID. They were all written, and then now they're going back to oral. I think the tip I would give is I get performance anxiety. So I do get very nervous talking to people, especially professors, because they are very intimidating. I would say for me, if they ask you a question, don't stumble upon your words. I usually now just ask them, could you just give me a second? Take a deep breath, and then I try to answer. If when I don't know the question, I just say I don't know. Because I don't feel like there's any point in waffling, because there has been times where people waffle and then they just annoy the professors because it's a waste of their time as well. So I would say in an oral exam, just make sure to read your paper properly before going up, to make sure that you've got all of what you've written down in your head and you've got it all ready to say as like a presentation speech. And then when they ask you questions, if you don't know it straight away, just take a second to breathe, think about it, and then answer it instead of just waffling along, because there's no point. They'd rather just want a straight answer than a long one that doesn't really answer the question. I think that's like the main one. I think a tip for procrastination and time management, because I have a really short attention span, I like to use the Pomodoro time. And that's where you just do maybe 25 minutes of work and have a 10 or 5 minute break, and then you do 25 minutes of work, 10 or 5 minute break, and then you do that maybe 3 or 4 times, then you have a bigger break, maybe half an hour. Just because I have a really short attention span, I know I can't do an hour and a half seminars. They do my head in, I fall asleep and it's really bad. So I know that my attention span can't do that. That's why I have to use something that makes sure like it breaks my time apart so that I can do things for longer. There's no point in me sitting there for 3 hours when I've only really realistically done maybe an hour's worth of work and procrastinated the other 2. So it's better to do it like that and just block off time to make sure that you do the studying, and also find out what time of day you study best. Some people are morning people, some people are night people. That it is what it is. You just have to make sure that you work around when you study best, and just again sleep properly. How I balance study and relaxing is planning a week ahead if it's maybe not around exam time, and just making sure that I finish the syllabus or aim to finish the syllabus maybe 10 days before the exam, so that there's always a couple of days that I can use to, maybe if I need to go out or there's friends' birthdays or things like that, I use the 10 days that I've allocated to not have any work to use it up before those 10 days, and just to make sure I finish the syllabus well ahead of time. Of course, that doesn't always happen. So when that doesn't happen, it is just more of a making sure I have a steady sleep schedule so that I can wake up in the morning to start the studying early. If I really need to cram, cramming's never a good thing, but I feel like everyone does it. And I would say planning a week or two ahead, just making sure that you know what social events that you might have, planning social events, and also going out and changing your study environment is the biggest one, I think, for me, because it feels like something's different even though I'm doing the same thing, which is studying. So sixth year, we have about, for winter semester up until March, you have 6 cycles that you have to go through, just like any of your other cycles from 3rd to 5th year that are rotations. And then after that, we have our graduate internship thing called from March all the way until November. So the graduate internship starts in March, and it's just like your other cycles that you would have had in 4th, 5th and 6th year, where you do one subject at a time, and then at the end of that you have an exam. You don't really have any lectures anymore at this point. You're just really going in and you're seeing patients, speaking to professors and getting taught content again, not even more discussion. They don't really teach you because they expect you to know all of this already. That's the thing with state exams. The exams that you will sit, the 5 exams, you would have already sat those exams before in 4th, 5th and 6th year. So it's just a recap, basically. You're just resitting those exams for the states. The exams are the same format as what you would have sat them before. It would be oral, you've got a practical part, some of them have multiple choice questions, and then again that is just all dependent on the department and what they decide for that year. But the questions won't differ from the ones that you already sat before. There will just be extra questions added on, but it won't be different questions. Same syllabus, basically. I think the hardest state exam, from what I've heard, was probably pediatrics or internal medicine. That's just because the 2 departments, again, are very specific with what they want from you in the exam, and they're also very, very content heavy. And I think the other harder exam is epidemiology, infectious diseases and social medicine, because a lot of people find it very tedious to learn. Again, that is very, very content heavy. I think internal and epidemiology is matched in terms of how much content you have to remember. State exams are graded the same way. They're graded from 2 to 6, like they always have been. And then those grades are all separated and then averaged out at the end. But that average is different from the average grades that you get up until March of your 6th year. So if you fail the state exams, there is a resit session for the state exams, and you just sit the exam. You don't have to resit the cycle again, and that's it. Yeah. So you get a second chance to pass the exam. You find out at the end of your last exam at states, well, given that you pass, and that's it, you're done. And then it's just documentation collection, and that's to do with all the student office and the dean is to get the transcripts and all of that. But November, last exam, and then graduation's in February, the following February. So hopefully I'll be done this time next year. When you get to 4th, 5th and 6th year, your days become a lot shorter. You have a lot more time to do things just because you only have 1 lecture and 1 seminar every day instead of something like 5 seminars a day that you do in 1st to 3rd year. And that's why you have a lot more time to spend with your friends and also to study. That's why it gets a lot easier for me to manage my time now that I don't have seminars all the time. And schedules aren't that bad. They really aren't. You wake up early because there are seminars and lectures at 8 o'clock, but then because you have to go to them, your day starts early, so you get a lot of time to do other things. So we meet patients when they have patients that are interesting to show us. Usually a lot of my friends will ask professors to go and see patients with them on ward rounds when we're not in seminar time, and they will organise with the professors then times to go see patients. We don't have to find our own patients. The professors will not provide us with patients, but will take us on ward rounds if we want to go see them. It's a lot of being proactive when you get to this stage at med school, and you just have to be able to ask, and if you don't ask, you never know. When working with patients, probably what I find most difficult is a language barrier, but they do seem to understand, and again, if you try and speak to them, you can use Google Translate, it's fine, they understand that this is not your mother tongue. They will try their best to be as simple as possible and try not to, if you ask them, they'll try not to veer too much away from what you're asking, because sometimes that can be a bit difficult as well. But then again, you do cover medical Bulgarian in third year, and I feel like if you just take that medical Bulgarian textbook with you and into class, it helps as well. I will start applying for jobs as soon as I get my GMC registration. So you have to send all your documentations that you get from the university off, obviously translated and notarized, to the GMC, and then they'll get back to you, and that's when you get your full registration, and after that you can apply. For where I want to work, it would ideally be close to home, which is in London. I don't really want to be too far away from my family. I've been far away from them for 6 years, so I kind of want to stay near home for a while. And for where I want to work in terms of specialty, don't really have one yet. I'm open to a lot of things, but I think after doing my cycles, I've definitely closed some doors, and obs and gynae is one of them. I do plan to specialise after a couple of years. I think the great thing is that I can take, so an F2, I can just apply for any job for like a couple of months in any department, and then I can even take an F3 year if I still don't really know what I want to do. Then I decide what I want, but I'm just glad I get some time to decide and just explore really the departments myself and see what I want. 100% studying in MUS has prepared me for life, I think, just in general. Moving to Bulgaria at such a young age, and also dealing with things that usually my parents would deal with, has helped just build my confidence. I feel like with a lot of what I've come across obstacle-wise in education, I'm not scared to ask for help. I'm not scared to voice my opinions anymore, and I'm not scared of people. I think that's the biggest one, just the different kind of people I've met at uni, be it Bulgarians or foreigners. I've just met so many different people that I'm just not scared to ask people or talk to people anymore. I think that's the biggest one. I think the growth of who I am as a person came in very introverted, left very extroverted and confident. Because I know now when I go back to the UK, I think the biggest thing that I took for granted was being able to speak the language. So now when I go back to the UK, I'm always ready to voice my opinions or say something or speak up, because I'm not usually able to here. I think that's the biggest one. The past 6 years have been insane. Pandemic and everything has made it seem like a roller coaster. Never thought I'd actually be able to make it to the end. But I genuinely believe that if I can do it, you can do it, because I'm probably one of the biggest procrastinator out there. I cry all the time, and if I could do it, honestly, anyone could do it. I have a very weak mental, so I believe in everyone that's going to get into med school are going to get to the end and be very proud of themselves that they made it through 6 years. 6 years has gone by really quick, and I've only got up until November this year left. and I can't believe it's coming to an end, my journey, hopefully. So fingers crossed that everything goes well for my state exams, and hopefully next year I can tell you guys what my experience is like being a junior doctor.